What we're trying to do is get the patients to see the right person at the right time. And that may be a doctor, and I'm not saying that we are not going to have doctors in the new healthcare system in Wokinngham, but quite often there are people better placed to look after you. We have an increasing number of patients in the area, and the demand for appointments is growing on an exponential scale over the past few years. Trying to deliver good healthcare for these patients at a timely manner with the right people is the biggest challenge the CCG is working on right now. We are looking at extending practices, we are looking at improving buildings, we are looking at increasing capacity in buildings. Secondly, we are looking at expanding the workforce model. Historically, you had a problem, you went to see the doctor. Over the past few years, you may go to see a nurse or a doctor, and we're looking at increasing that range of team quite dramatically. We're introducing a wider range of healthcare assistants which provide a lot of the more junior nursing and admin roles for the patient. We are expanding our primary care team of nurses to include nurses who are looking mainly at acute care, i.e. illness on the day. The other three ones that we're working on, particularly in Wokinngham, are pharmacists in practices, which some practices already have. We're trying to roll this out over the whole footprint of the Wokinngham CCG. The practices have just been successful in applying for money to provide this, and we would hope to have a part of a pharmacist in every practice by this time next year. This will take some of the workload off of the doctors who, rather than seeing them about a medication problem or a medication review, you may be seen by a pharmacist. The first physicians associates, who are a new breed of health professionals who are looking at working underneath the GPs together with our big team of nurses, are beginning to roll out of Reading University, and we see these fitting in to chronic disease care as well as acute on-the-day care. And thirdly, I think we're looking at whether we can use other sectors of healthcare workers, such as paramedics for emergency visiting, mental health workers going forward, to try and bring that element closer to home for the patients. What we're working on is a team called the Community Navigators, which are a signposting service to all patients to allow them to access voluntary or specialist groups to help them with any disease or any issue of living that they have. I think the patients will hopefully get a more timely appointment with the most appropriate healthcare professional to sort out their medical needs.